Hi, my name's Brooke, and this is a quick pathophysiology and pharmacology of Hashimoto's thyroiditis. So just a quick introduction to the case study. 35-year-old Rebecca presented to her endocrinologist with symptoms of fatigue, evidence of weight gain, dry skin and hair loss. She stated this has occurred for around several months now, and Rebecca has been diagnosed with Hashimoto's thyroiditis. So Hashimoto's thyroiditis is an autoimmune disease, and Rebecca has a past medical history of autoimmune issues and Hashimoto's thyroiditis throughout the family history. So background behind the name of this disease is Hashimoto's comes from the Dr. Hikaru Hashimoto, who identified the disease in 1912, and thyroiditis means inflamed thyroid. Hashimoto's thyroiditis occurs when the thyroid cells are killed by an antibody-mediated immune response. And how this works is the thyroid antibodies attack the thyroid cell and the surrounding tissue. This action causes the inflammation of the thyroid gland, which causes tenderness, scarring, and swelling, which is pretty present in Rebecca's case, particularly to the swelling. These antibodies are the cause of autoimmune thyroid disorders such as Hashimoto's thyroiditis. This disease can progress into subclinical hypothyroidism as there is a lack in the production of T4 thyroxine and T3 tridothyronine hormone, which in turn causes weight gain, decrease in metabolism, as well as hair loss, as there is not enough T4 to control DNA and protein synthesis. However, this disease does not always develop into hypothyroidism. It can kind of maintain with just having a swollen thyroid. Hashimoto's thyroiditis is diagnosed by observing the clinical presentations as well as laboratory work. In this laboratory work, you would be looking for elevated TSH levels and a decrease in T4 or thyroxine levels. These clinical presentations that you would be observing for include hair loss, bradycardia, fatigue, weight gain, and dry skin, as well as having tenderness at the base of the neck upon palpation. These symptoms are all present in Rebecca's case, suggesting that her immune system is attacking itself. When looking at laboratory results, as stated before, you're looking at TSH levels or elevated levels, as it is the indication of Hashimoto's thyroiditis. So how this pathophysiology works is the thyroid gland releases T3 and T4 hormones that regulate the thyroid hormones, essentially. These thyroid hormones are responsible for controlling weight, metabolism, and temperature. In order to treat this disease, patients are commonly prescribed a T4 hormone therapy replacement, which is commonly known as levothyroxine. This medication helps stimulate the production of thyroid hormone. And in this picture, it kind of just describes how a person can get or progress onto having Hashimoto's autoimmune disease. So some pharmacological aspects of Hashimoto's thyroiditis. So the most common drug that is used to treat Hashimoto's is a synthetic thyroid hormone, T4 or thyroxine, and this medication that is used is called levothyroxine. This medication comes in a pill, capsule, or liquid form, and it is a oral root medication, and it can be crushed or cut up for the younger generations. So this synthetic hormone is designed to restore normal metabolism. Levothyroxine may also be known as altroxin, levothyroid, and p-thyroid. So levothyroxine belongs to the drug class of hormones as it works by replacing hormones that are regularly produced by the body. And the mechanism of action for levothyroxine begins with thyroid stimulating hormone, or TSH, activating the thyroid to secrete T4 and T3. And these thyroid hormones perform their physiological measures by binding to the thyroid receptor proteins within the cell nucleus, where it can control DNA transcription and protein synthesis. And once levothyroxine is within the nucleus, it can influence the body to increase metabolism by increasing glucogenesis and protein synthesis. Indications of this medication include when a hormone replacement therapy is needed, and this can be in primary or thyroidal, secondary or pituitary, and tertiary or hypothalamic hypothyroidism. Other indications of this medication include surgery and radioactive iodine therapy when treating thyroid cancer. Some relevant nursing considerations when looking after a patient with levothyroxine charted is to monitor the patient's TSH levels. This will determine the effectiveness of the drug. So if laboratory work comes back and TSH is high, it can determine that the levothyroxine is not working efficiently and needs to be reviewed. However, if TSH levels are within the normal ranges, it can be determined that the levothyroxine is working effectively. And some other nursing considerations include monitoring the potential side effects that a patient may encounter. So this could include increased fatigue, increased appetite, heart palpitations, and nervousness and anxiety. So these side effects are an indication that there could be a potential for over-medicating, and this is when you would check for TSH levels and T4 levels in that laboratory work. So the nursing team should also consider time management when it comes to this medication, as it needs to be taken on an empty stomach and at least half an hour before other medications. This is due to potential reduction of absorption of the drug. And these are just the references, which will also be at the bottom of the sway as well. Thank you.